Hello everyone, this is Golden Age Lab. Before we start today's video, I want you to take a moment and think about something. How many of you eat almonds or walnuts every day for your health? Maybe you grab a handful as a snack or sprinkle them on your oatmeal each morning. If you're nodding your head right now, you're not alone. Millions of Americans eat nuts daily because we've been told they're incredibly healthy. And they are. But here's something that might really surprise you. For some people, these same nuts can actually be dangerous. And I'm not exaggerating. In the United States alone, approximately 1.5 million people visit emergency rooms each year because of nut allergies. And tragically, between 150 and 200 people actually die from them every single year. According to a major 2014 study in the Journal of Allergy and Clinical Immunology, about 90% of deaths from food allergies are caused by nuts. 90%. So today, I'm going to walk you through 5 critical dangers of eating nuts that you absolutely need to know about. I'll explain who should be especially careful. And most importantly, I'll show you exactly how to eat nuts safely so you can still enjoy all their amazing health benefits. This video might save your life or the life of someone you love. So please stay with me until the end. And if you find this information helpful, please hit that subscribe button and the bell icon so you never miss our health tips. Let's get started. Danger number 1, allergies. All right, let's talk about the first and most serious danger, nut allergies. Now, I know some of you might be thinking, oh, I don't have allergies, I can skip this part. But please don't. Because what I'm about to share could help you recognize the signs if someone around you is having a reaction. It could literally save a life. Here's the thing about nut allergies. They're not just a bit uncomfortable. They can actually kill you. And they can kill you fast. Let me share some numbers with you. About 1.8% of American adults have nut allergies. That's roughly 4.6 million people. And here's what's really alarming. That number has tripled in the last 20 years. So why are nut allergies so dangerous? When you have a nut allergy, your immune system mistakes the proteins in nuts for dangerous invaders. So it launches this massive counterattack way more than necessary. This overreaction is called anaphylaxis. Here's typically how it starts. Your mouth begins to itch. Your throat feels a bit tickly. You might think, oh, it's nothing. But then, within just a few minutes, sometimes even seconds, things get serious. Your lips start swelling, your tongue swells. Your throat feels like it's closing up. Breathing becomes harder. Hives pop up. You feel dizzy. Your heart races. You might vomit. And in the worst cases, your blood pressure drops and you can lose consciousness. According to research, all of this can happen in an average of just 6 to 15 minutes after eating nuts. In some cases, symptoms start in as little as 30 seconds. That's barely enough time to realize what's happening. So who needs to be especially careful? First, people who already know they have nut allergies. If you've had a reaction once, the second reaction is often more severe. Second, people with other food allergies. Research shows that people with one food allergy are 7 times more likely to develop other food allergies. Third, people with asthma. This is really important. Asthma patients with nut allergies have a 4 to 5 times higher risk of dying from anaphylaxis. Fourth, people with a family history. If one parent has nut allergies, you have a 20 to 40% chance of developing them too. And here's something that surprises people. Nut allergies can suddenly develop when you're an adult. You might have eaten nuts your whole life, and then one day your body changes. So what should you do to stay safe? First, if you're trying a nut you've never had before, start really small. Just a tiny piece. Wait 15 minutes and see how you feel. Second, never eat nuts when you're alone. Always have someone nearby. Third, read food labels carefully. Look for contains tree nuts, or may contain traces of nuts. Fourth, at restaurants, tell your server, I have a nut allergy. Does this dish contain any nuts? Fifth, if you have allergies, always carry an EpiPen. Research shows that the faster you get epinephrine after a reaction starts, the better your chances of survival. Critical. Use EpiPen immediately for severe symptoms and call 911. And if you experience severe symptoms, difficulty breathing, throat closing, severe swelling, call 911 immediately and use your EpiPen without hesitation. Danger number 2. Blood thinners. Now, this second danger is really important for many of you. If you take blood-thinning medications like warfarin or Coumadin, please pay close attention. Here's the problem. Almonds are packed with vitamin E. Just one handful contains 37% of your daily requirement. Vitamin E thins your blood. Your warfarin medication does the same thing. When you combine them, your blood becomes so thin that it won't clot properly when it needs to. A 2011 study in pharmacotherapy confirmed that vitamin E-rich foods significantly increase warfarin's effect and bleeding risk. So what could happen? Frequent nosebleeds, bleeding gums, easy bruising, blood in urine or stool. In serious cases, brain hemorrhage or internal bleeding. Research shows that about 2.1% of warfarin patients experience serious bleeding every year, and many cases are caused by food interactions. Walnuts cause similar problems because they're loaded with omega-3 fatty acids, which also thin blood. So if you take blood thinners, here's what you need to do. First, talk to your doctor before eating nuts regularly. Ask, "Doctor, I'm taking warfarin. Is it safe for me to eat nuts?" Second, if approved, consistency is everything. Eat the exact same amount every single day. Don't eat a lot one day and skip the next. That makes your levels dangerous. Third, keep it small, about 10 to 15 nuts per day, roughly 20 grams. Fourth, get blood tests every 2 weeks instead of monthly. Fifth, avoid other blood-thinning supplements like ginger, garlic, and fish oil. And please wear a medical alert bracelet that says "I take warfarin." Danger number 3. Digestive issues. Let's talk about your digestive system. If you have IBS, diverticulitis, or Crohn's disease, nuts can cause real problems. First, what is diverticulitis? As we age, small pouches can form in our large intestine. About 60% of people over 50 have them. When these pouches get inflamed, it's diverticulitis, and it's extremely painful. Here's something interesting. A large 18-year study following 47,000 men found that eating nuts doesn't increase diverticulitis risk in healthy people. But if you already have diverticulitis, it's different. Research shows that during acute attacks, you should avoid nuts. Small, hard pieces can get stuck in inflamed pouches and make inflammation worse. Symptoms include severe pain in your lower left abdomen, fever, nausea, and bowel changes. About 15 to 20% develop complications. That might need surgery. So if you have digestive issues, here's what to do. First, grind nuts into butter. Research shows grinding increases digestibility by 30%. Second, start with tiny amounts, 5 to 7 nuts. Third, soak them overnight. This softens them and improves digestion. Fourth, chew thoroughly at least 20 to 30 times. Fifth, drink plenty of water. And if you're having a flare-up, stop nuts completely. Wait at least 2 weeks after recovery before trying again. For IBS patients, research shows cashews and pistachios worsen symptoms, but almonds and macadamias are usually safer. Danger number 4, kidney disease. This is really important if you have kidney problems or kidney stone history. The problem is oxalate's natural compounds in nuts that can form kidney stones. Almonds are particularly high, containing about 122 milligrams per 100 grams. Research shows that consuming over 50 milligrams of oxalate daily increases stone risk. Just one handful of almonds exceeds this. Warning: 1 handful of almonds, 50 mg oxalate daily safe limit. Kidney stones cause severe side or back pain, painful urination, and blood in urine. Some people say it's worse than childbirth. Studies show kidney stones have doubled in 30 years, possibly linked to increased nut consumption. For chronic kidney disease patients, it's worse. Your kidneys can't filter oxalates properly, so they build up everywhere: kidneys, bones, joints, heart, blood vessels. Plus, nuts are high in phosphorus and potassium. When kidneys fail, these minerals build up dangerously. Research shows that when potassium levels go above 5.5 in kidney disease patients, death risk more than doubles. Critical. High potassium in CKD patients equal 2x death risk. If you have kidney disease, first, choose low oxalate nuts, macadamias, and pecans instead of almonds. Second, keep portions tiny: 5 to 7 nuts, only 1 to 2 times weekly. Third, soak overnight. This reduces oxalates by 30 to 40%. Fourth, drink lots of water, 10 to 12 glasses daily. Research shows each extra liter reduces stone risk by 13%. Fifth, get kidney function checked every 3 months. Honestly, if you're on dialysis, recent research strongly advises avoiding nuts altogether. Danger number 5, medications. The last danger is how nuts interact with medications. Thyroid issues. Brazil nuts contain enormous amounts of selenium. Just one nut has 68 to 91 micrograms, when daily recommendation is only 55 micrograms. Eat 5 Brazil nuts and you're approaching toxic levels. Research warns that over 400 micrograms daily causes thyroid dysfunction. A 2017 case report documented a woman who developed hyperthyroidism from eating 10-15 Brazil nuts daily. Racing heart, shaking hands, anxiety, insomnia, weight loss, hair loss. She recovered when she stopped. Warning 5. Brazil nuts daily can cause thyroid problems. If you take thyroid medication, walnuts are also problematic. Research shows walnuts can reduce medication absorption by up to 55%. Solution? Take your medication, wait 4 hours, then eat nuts. Diabetes medications. Nuts lower blood sugar by 5 to 10%. Combined with diabetes medications, this can cause dangerous hypoglycemia, shakiness, sweating, confusion, even unconsciousness. Blood pressure medications. Nuts lower blood pressure by 2 to 5 mmHg. With medications, this could drop it too much, causing dizziness and falls. Antibiotics. Some antibiotics don't work well if eaten with nuts. Avoid nuts 2 hours before and after antibiotics. If you take medications, first, every time you start a new medication, ask, "Can I eat nuts while taking this?" Second, create a 2 to 4 hour gap between medication and nuts. Third, keep a complete medication list. Show it to your doctor. Fourth, report unusual symptoms immediately. Fifth, stop nuts 2 weeks before surgery. They increase bleeding risk. How to eat nuts safely. After all that, you might think, should I just never eat nuts? No, despite everything, nuts are wonderful foods. A groundbreaking 30-year study of 120,000 people found that regular nut eaters had 20% lower risk of dying from any cause and 29% lower heart disease death. Major study: 30 years, 120,000 people, nuts 20% lower death risk. Another analysis of 29 studies found that just 28 grams daily reduces heart disease risk by 21%, stroke by 12%, cancer by 15%. So nuts are good for you. You just need to eat them smart. First, know yourself. Understand your allergies, kidney function, digestive issues, and medications. If you have concerns, talk to your doctor first. Second, appropriate amounts. The American Heart Association recommends 1 handful daily, 28 to 30 grams. That's 23 almonds, 7 to 8 walnuts, 18 cashews, or 19 pecans. Research confirms this is optimal. More doesn't mean healthier, just extra calories. Third, choose wisely. Heart health. Walnuts. Brain health. Walnuts. Kidney stones. Macadamias or pecans. IBS. Almonds or macadamias. Thyroid issues. Avoid Brazil nuts. Fourth, store properly. Keep in airtight containers, refrigerated. This triples freshness. If bitter, throw away. Fifth, Choose unprocessed. Buy unsalted, raw, or roasted. Research shows salted nuts increase blood pressure and heart disease risk. Avoid honey roasted or chocolate covered too much sugar. Sixth, chew thoroughly. Chew 20-30 times. Research shows better chewing means better nutrient absorption. Seventh, good combinations. Great with yogurt, probiotics aid absorption. Fruit prevents blood sugar spikes. Salads, oatmeal sustained energy. Avoid processed meats, alcohol, carbonated drinks. Eighth, special situations. Surgery stop 2 weeks before. Pregnancy. Safe in moderation may even reduce baby's allergy risk. Breastfeeding. Watch baby for reactions. Children under 5. Grind finely choking hazard. Pre-exercise. Small amounts 1 to 2 hours before. When to get help. Mild indigestion. Walk 20-30 minutes, drink peppermint tea, massage stomach. See doctor if it lasts 24 hours. Allergic reactions. Mild. Stop eating, rinse mouth, take antihistamine. Severe difficulty breathing, throat closing, severe swelling. Call 911 immediately and use EpiPen. Research shows using it within 5 minutes dramatically improves survival. Emergency difficulty breathing equal call 911 plus use EpiPen now. Bleeding signs? Stop nuts, check medications, see doctor. Emergency if severe. Hypoglycemia. Immediately consume fast sugar juice, candies, recheck in 15 minutes. Call 911 if unconscious. Severe abdominal pain. Stop solid food, drink clear liquids. See doctor within 24 hours. Emergency if fever above 101F or bloody stool. Conclusion. All right, everyone, let me wrap this up. Nuts aren't bad. They're superfoods that can help you live longer. Major research proves this, but they need to be approached thoughtfully. Remember 3 things. First, know your health status: allergies, kidney function, medications, digestive health. Second, eat nuts correctly. 1 handful 28 daily, unsalted, fresh, refrigerated, well chewed. Third, listen to your body. If something feels wrong, adjust or get help. Critical warning. If you have nut allergies, kidney disease, take blood thinners, have digestive diseases, take thyroid medication, have diabetes, or take multiple medications, talk to your doctor first. This isn't optional. Everything I've shared comes from peer-reviewed research in major medical journals. But nothing replaces personalized advice from your doctor who knows your complete history. Your health choices today shape your life tomorrow. If this helped you, please give it a thumbs up. Subscribe to Golden Age Lab. Hit the bell icon. Share with family who might benefit. Leave a comment. Tell me your experience or questions. Thank you for watching. I wish you and your family vibrant health and many wonderful years ahead. This has been Golden Age Lab. Take care of yourselves. Make informed choices, and remember, knowledge is power. Until next time, stay healthy and be well.